Older Americans rely on the benefits of Social Security and Medicare, but both programs are very complex. Tonight on The Best Times, we'll get answers to the public's most common questions about Medicare and Social Security. Funding for The Best Times is provided by the Plow Foundation, striving to do the greatest good by helping the greatest number of people since 1964. Additional funding is provided by the members of WKNO. Thank you. Hello, I'm Cris Hardaway. Welcome to this edition of The Best Times, a series that looks at life after 50. One of the rites of passage as we age is enrollment in our nation's social programs, Medicare and Social Security. Both are vital programs to older Americans, but both are filled with complexities. Tonight we're going to attempt to answer some of the most common questions about Medicare and Social Security. But before we start asking questions, let's review a little history of these two social programs. Social Security was enacted in 1935, born out of the Great Depression. At that time, over half of America's seniors were financially insecure. In signing the Social Security Act, President Franklin Roosevelt called it a law that will take care of human needs. It remains as the only retirement income that you can't outlive. In 1940, Ida Mae Fuller was the first American to collect Social Security. Her first check was for $22.54. 30 years later, on July 30th, 1965, President Lyndon Johnson signed the bill creating the Medicare program. After nearly 50 years of discussion and debate on national health insurance, President Johnson presented the first Medicare card to former President Harry Truman in recognition of his efforts to establish the Medicare program. In 1965, less than half of Americans over 65 had any form of health insurance. Today, 90% of seniors, that's over 46 million Americans, are covered by Medicare. Taken together, Social Security and Medicare account for 41% of federal government spending. To try to understand more about Social Security and Medicare, I've invited two experts on the topic into the studio. Ann Clifton is the public affairs specialist in the local office of the Social Security Administration. And Joanne Lowe is the Choices Outreach Coordinator at the Aging Commission. The questions I'll be asking come from a list of the most frequently asked questions by you, the public. Let's begin asking questions and talk about Medicare. We'll start with Medicare, if that's fair.
All right, yes.
What are the A, B, C's, and D's of Medicare? Give me a brief explanation.
Okay, well, A is your hospitalization, and it's free because you earned it during those years that you were working. B is for medical and other things such as medical equipment and things like that. C is a privatized plan, which covers A, B, and D. And then Part D is your prescription plan.
And at what age are you eligible for Medicare?
65.
65. Let's turn to Social Security, because all of our lives we've attached retirement to age 65. That's not the case with Social Security. You don't get your check at age 65 anymore.
Right. Well, you can actually file as early as age 62, but your full retirement age varies based on the year of your birth.
And how do I find out my full retirement age?
You can use our website at at socialsecurity.gov, or you can always give us a call at 1-800-772-1213, and we'll be glad to talk to you about that.
All right. How do I qualify for Medicare?
Well, first qualification is that you are 65 years of age, and you have to have worked 40 quarters or 10 years in order to qualify. Really, those are the only qualifications. And some people who are disabled, after they've been disabled for at least 24 months, are eligible for Medicare as well during that 25th month.
And what about the eligibility requirements for Social Security?
You have to have worked at least 10 years where you earn 4 credits of coverage. This year it's you have to earn at least 1,300 to earn 1 credit, so you can earn 4 credits per year. So if you've worked in your lifetime 10 years, then you've earned your 40 credits. So it's kind of a play on play. A lot of times Medicare kind of plays on Social Security too. 2 other ways that you can get Medicare too is if you have ALS, which is Lou Gehrig's disease, or if you have kidney dialysis or have a transplant, you can also maybe qualify under those conditions. And if you've lived in Libby, Montana for at least 6 months or more, there are certain health conditions that might let you qualify for it as well.
I have to ask, why?
I don't know. They do have some health conditions. That legislation came into play in 2010. So I don't know what those health conditions are, but I do mention it in case someone might qualify.
Okay. Let's go back to the parts of Medicare, because the next question is people ask is, why do I need Part B? So tell me again what Part B is and why do I need it? Because it actually costs money. Part A is free, right?
Yes,
If
that
you
is
qualify.
correct. Yes.
Okay, all right. Why do I need Part B?
Well, Part B pays for your medical expenses when you go to the doctor. So it's going to cover 80% of whatever the cost is for the service that you're receiving from your physician. And without it, you have no physician coverage.
Okay.
Or medical equipment coverage either. I mean, that Part B covers that part as well.
So without it, you're not covered for doctor's visits or the physician or the surgeon or the anesthesiologist or anyone else?
Yes.
Okay.
Any doctor.
All right.
Even when they come to see you in the hospital.
Yes.
That's considered a doctor's visit.
True.
Yeah.
True. How does one get estimates for future Social Security benefits?
There's 2 major ways that you can get estimates. One of those ways is through our retirement estimator at socialsecurity.gov/estimator, where that differs from the estimate that we previously mailed out every year, is that it allows you to do what-if scenarios. So if you're going to file at age 63 or maybe age 64, it gives you that opportunity to change the age that you want to file. Or maybe you become a millionaire at age 60 and see what the difference would be. It allows you to do that. The other is through our My Social Security account. It's a free online account that allows you to access your information. It gives you estimates at age 62, your full retirement age, and age 70. That assumes that you're going to work until age 62, so it doesn't allow you to do those what-if scenarios there. We also still mail out that annual statement to individuals who are age 60 or older, and those individuals can get that statement in the mail unless they have a My Social Security account in which they can access that at any time.
At what age would you recommend someone start doing those what-ifs?
Well, the what-ifs aren't so much important as checking your earnings record. We recommend that as early as age 25. We want to make sure that your earnings record is correct, and if you wait until it's time to retire, you may have missing earnings, or maybe you have earnings on there that shouldn't be there. We've had people also find identity theft because there were earnings that were posted that shouldn't be on there. So we recommend it as early as age 25, and at any point, if you're age 18 or older, you can set up that My Social Security account and view it any time.
Let's talk about the drug plan, because people have questions about, do they have to have a prescription drug plan?
Well, they don't have to have, but if they don't get one and then they decide they need one later, they're going to be penalized 1% for every month that they didn't have it, and that's a lifetime penalty. And that penalty is the same with Part B, except it's a 10% penalty for every month that they didn't have it. And that's a lifetime penalty.
It's a substantial penalty.
Yes, it can be.
Now, am I right? Original Medicare, Parts A and B, doesn't cover any drug costs, correct?
Correct.
Okay. So
Well, I can't say that. B does, depending on what it is. Some injectable type drugs that might be given in the hospital.
Okay, but your typical prescription that you go to the pharmacy for
Yes,
is not covered. What would be the best strategy? Why would someone need a drug plan?
Well, mainly one thing is to not get stuck with that penalty later on in life. The other would be that's the only way that, unless you go out and buy a private policy, which are way too expensive at that age, that's the only way your drugs are going to be covered.
All right. Let's talk about work and Social Security. How does continuing to work affect your check?
There's a couple of things. First of all, you are limited to how much you can earn if you're under your full retirement age. In 2017, that's $16,920. Anything over that, we take $1 for every 2. Once you turn your full retirement age, you can earn $44,880 in 2017, up until the month that you turn your full retirement age. And once you turn your full retirement age, you can earn any amount and it not affect your Social Security. The other thing is, as you continue to work in retirement, because we're looking at your lifetime earnings when we figure your benefit, there are some situations where those earnings could actually increase your benefit. Not always, but there is that possibility.
Is there a limit on that? I mean, if you're working beyond age 70, let's say, as long as you're working, there's a possibility it can accrue and increase your benefits.
The thing that people don't realize is that as people retire or are at retirement age, sometimes their earnings reduce, so it may not affect their benefit because of the fact that we're looking at your lifetime highest earnings, and as you are older, your earnings may decrease. But some people may find another job or a different job that may increase it, and it's something that we do automatically for you once those earnings have been posted.
All right. If someone is under 65, when and how could they qualify for Medicare?
If they were disabled, or as Ann said earlier, they have renal disease or they have Lou Gehrig's disease.
So there are certain conditions where 65 isn't the hard limit. All right. How are benefits figured for Social Security?
Yeah, like I mentioned a moment ago, individuals, we look at your entire work history, not your last 5 or your highest 10. We're looking at your entire work history. So we take the highest 35 years and take that really big number, divide it by 420. That's not a magic government number, that's just 35 times 12. And we plug that in and get your average index monthly earnings. Now that average index monthly earnings is plugged into a formula, and that formula is the same for everyone, unless you work for someone that did not pay into Social Security, such as a government agency or a local company that has their own pension plan. Here in the Memphis area, we have quite a few of those that have their own pension plan. And then we look at your formula a little bit differently because you might be subject to an offset.
Sounds complicated.
It can be, but for the most part, it is pretty clear. Right. We have worksheets where you can figure it yourself, or we can certainly do it for you.
Let's talk about, the next question is about supplemental or Medigap policies. And first of all, I guess explain what they are, why you would want to purchase one, because again, this is something you have to purchase, and what's the best?
Okay, well, let's start off with the best. The best is going to be the lowest price that you can get because they're standardized policies. They run like through A through J or L, and if you buy an L, they're all the same. If you buy an F, they're all the same. You know, it doesn't vary. The only thing that really varies is the cost because it's government standardized.
And when you're saying A through L, are you describing different coverages?
Exactly.
Okay, all right.
Exactly. And why would you want to have one? Well, because if you don't have one, you're going to end up paying that 20% out of pocket that Medicare does not cover, and that can get quite costly.
Our Social Security cards, how do you apply for one to begin with, and what if I need a replacement one? How do you go about doing that?
So let's start with the application process. If you're a child that's born in the United States, it's an automatic process. The hospital takes care of that for you. If you are someone that has moved to the United States and recently are eligible for a Social Security card because you are here as a legal permanent resident, or maybe you're a recent citizen, you can go to the office to apply in person, and you would need to prove your identity and citizenship. If you are someone getting a replacement, if you live in the state of Mississippi or Kentucky, you can actually get those online. And there's some other states within the U.S. that actually allow you that as well. But you do have to have the My Social Security account, but that is an option. Tennessee's not on board yet, but we will be in the future. And we're continuing to add more states as we go. You can always mail it in an application, but you do have to provide the actual documents. They cannot be photocopied. So a lot of people don't want to mail those in, so they just feel more comfortable by bringing them into the office.
Let's go back to talking about Medicare Part B, because that has a cost associated with it.
That is true.
How much is it?
The standard cost today is $134.
$134, which, if you're on Social Security, will be deducted automatically from your check, correct?
Correct.
All right. How long will it take to get a Social Security card?
Usually it takes about 2 weeks, and that, when I say 2 weeks, 7 to 10 business days. Anything more than that. Now, if it's a new card, if you've never had a card before, sometimes it can take up to 30 days just because we have to go through a process of verification before we process the card.
On Medicare, we mentioned Part B. We just talked about its cost. Is there a way for people to get assistance with the cost of Medicare?
There is. They can apply for what's called the Medicare Savings Plan, which is funded by TennCare. And if they meet the income guidelines, then they would qualify to get that paid for them by TennCare.
You mentioned the My Social Security account. Give me more details. What is that account? How do you apply for it? What can you do with this account?
It's an online account. It's a free, easy-to-use portal that allows you to view your information, and once you become eligible for benefits, you can change some of your information as well. And in order to sign up for it, you go to our website at socialsecurity.gov, choose My Social Security account. It's going to ask you a series of questions about you and biological information, but because most of us share a little bit more than we probably should, it's going to ask you some out-of-pocket questions that allow us to verify that you are who you are. Once you get through that, then you can set up your username and password. Now, this particular account is something that you can use as early as age 18. You do have to have a valid email address and a U.S. mailing address.
Is that the best way to monitor your account?
It is, because it is something that you can access pretty much every day at your convenience.
Joanne, what is the low income subsidy and the Medicare Savings Plan? Two things I have not heard of.
Okay, well, the low income subsidy is something that's paid for by Social Security.
Yeah, we like to call it extra help.
Yeah, or extra help, it's called either one. And basically what it does is help those individuals who meet certain qualifications as well, pay for their prescription drugs to where there's a limit on what they can be charged for them. And it can also pay for their premium for their drugs. And it's based on income. So they may get 100%, they may get 50% coverage, they may get 75%. So it varies.
So the assistance is out there.
Yes.
But you have to know to take advantage of it.
Yeah, and you just
key.
call us and we will do the online application, as well as Social Security does the online application. It's a very easy process to do. Now, the Medicare Savings Plan, which will pay for their Part B premium, it'll pay for their co-pays when they go to the doctor, like the 20%, if they qualify financially. And it'll also pay their co-insurance and deductibles in the hospital, if they qualify financially, and that is covered by TennCare. And of course, you have to meet those income guidelines to qualify for that as well.
All right, here's a question. Must I pay taxes on my Social Security benefits?
There is that possibility. If the individual has greater than $25,000 in income, whether that be with Social Security and what other income they may have, there is that possibility that they would have to pay federal income taxes on those benefits. But we tell people, if you want to know how much you have to pay and that sort of thing, you want to contact IRS.
Okay. Any other taxes beyond federal, state, local? No
It really kind of depends on the state. I mean, obviously Tennessee does not have a state tax. There's some situations in other states where if you meet a certain age, then you wouldn't have to file those taxes or pay them. But we always tell people, contact those agencies, not us, because we're not the ones who collect those taxes.
Yeah, you won't be able to answer that question.
No.
Let me go back to Medicare Part C. Explain to me what it is again, and the difference from Part A and B, which I think is often referred to as original Medicare. What are the differences?
Well, Part C is privatized Medicare. So different insurance companies have contracted with Medicare to provide those Part C plans. It covers their hospital, the physician, and their prescription drug plans. They work for some people, and some people they don't work for. You can only use network physicians in those policies, whereas with Medicare, you can use anybody who accepts Medicare. So you have a wider range of physicians to choose from with original Medicare versus the Plan Cs.
This is a question from someone who, a spouse who has not worked. Are they eligible for Social Security benefits?
That is a possibility. They do have to be age 62 or older. Their spouse has to be eligible for benefits. And what they would do is just apply for benefits either by calling us to set up an appointment to do it over the telephone or in person, or they can do that online as well.
All right. How and when can I change my Medicare coverage?
During open enrollment, and that is October 15th through December the 7th of every year. And there are sometimes special circumstances to where an individual could change their plan at any given time. If they have the low income subsidy or they're on the Medicare savings plan, they can change their Part D plan anytime.
So every year during the open enrollment, the recommendation, I guess, is review
Yes.
your insurance needs.
Yeah, because things change, the formularies change, the medications you're on change, so you want to make sure that you're still getting the best deal for your money.
Survivor's benefits. Who can get survivor's benefits and how do you apply for them?
The earliest that an individual could file for survivor's benefits is age 60. There are some situations where an individual could qualify between the ages of 50 and 60 if they're disabled, but there are certain qualifications that they would have to meet, and it does require a disability decision. Those individuals who qualified at age 60, they are still subject to the earnings limit, just like an individual who is retired. And if they're under their full retirement age, they are subject to a lower earnings limit. The easiest and fastest way is to call us. Those widow's claims and widower claims are not available online, but they can give us a call at the 1-800 number, 1-800-772-1213, and set up an appointment to do it in person or over the telephone.
All right. Will Medicare coverage follow me if I move out of state?
Yes.
What about out of the country?
No. Well, let's back up. A supplement will cover you depending on which one you buy, if you're out of the country. So you may want to check with your supplement to see what it might cover if you're out of the country, but Medicare, no.
All right. Must I pay Social Security taxes on my earnings after full retirement age?
As long as you are working and your employer is subject to paying Social Security taxes, then you are subject to pay those taxes as well.
Simple answer. What kinds of health-related services are not covered by Medicare? I know it may be a long list, but summarize it for me. What does Medicare not pay for?
Well, it does not cover nursing home services. A lot of people think it does. It will only pay up to 100 days, and that's for a rehab situation. Medicaid actually pays for the nursing home. Original Medicare does not cover anything but medical per se, no dental, no vision, no hearing, nothing like that.
All right. If you're divorced, can you get benefits from your spouse's record?
There is that possibility. You do have to meet some requirements. First of all, you have to be age 62 and your ex-spouse has to be age 62 and potentially eligible. Doesn't mean that they necessarily have to file, but they do have to be potentially eligible. You had to have been married for at least 10 years, and if you are filing on a spouse, the divorce had to have been at least 2 years in the past. And you also have to be not eligible for higher benefits on your own record, because there is new legislation that requires that if you are eligible on your own record, then we pay that first, and then we would pay anything additional if there was any spousal benefits as a divorced spouse on the record.
Well, I have one last question to both of you, and that is for viewers who have more questions and need answers. Where can they go?
You can go to our website at socialsecurity.gov or call us at 1-800-772-1213. That phone line is open Monday through Friday, 7 a.m. to 7 p.m., depending on their local time. Or they can visit one of our local offices. We do have those throughout the U.S., and they can visit one of those as well.
And the Medicare questions?
You would call 1-901-222-4111 for information and assistance. And they would put you in contact with the SHIP program, is what it's called.
All right. Joanne, Ann, thank you very much for being on The Best Times.
Thank you.
Thank you for having us.
To get your Social Security or Medicare questions answered, call one of these numbers or visit their websites. Want more information about life after 50? Go online to watch more shows and find more resources. And send us your feedback and story ideas to besttimes@wkno.org. That's all for this edition of The Best Times. Please join us next week for more stories about life after 50. Until then, I'm Cris Hardaway. Thanks for watching. Good night. Funding for The Best Times is provided by the Plow Foundation, striving to do the greatest good by helping the greatest number of people since 1964. Additional funding is provided by the members of WKNO. Thank you. History of these two social programs. Social Security was enacted in 1935, born out of the Great Depression. At that time, over half of America's seniors were financially insecure. In signing the Social Security Act, President Franklin Roosevelt called it a law that will take care of human needs. It remains as the only retirement income that you can't outlive. In 1940, Ida Mae Fuller was the first American to collect Social Security. Her first check was for $22.54. 30 years later, on July 30th, 1965, Ann Clifton is the Public Affairs Specialist in the local office of the Social Security Administration. And Joanne Lowe is the Choices Outreach Coordinator at the Aging Commission. The questions I'll be asking come from a list of the most frequently asked questions by you, the public. Let's begin asking questions and talk about Medicare. We'll start with Medicare, if that's fair.
All right, yes.
What are the A, B, C's, and D's of Medicare? Give me a brief explanation.
Okay, well, A is your hospitalization, and it's free because you earned it during those years that you were working. B is for medical and other things such as medical equipment and things like that. C is a privatized.
Since 1964. Additional funding is provided by the members of WKNO. Thank you. Hello, I'm Cris Hardaway. Welcome to this edition of The Best Times, a series that looks at life after 50. One of the rites of passage as we age is enrollment in our nation's social programs, Medicare and Social Security. Both are vital programs to older Americans, but both are filled with complexities. Tonight we're going to attempt to answer some of the most common questions about Medicare and Social Security. But before we start asking questions, let's review a little. President Lyndon Johnson signed the bill creating the Medicare program. After nearly 50 years of discussion and debate on national health insurance, President Johnson presented the first Medicare card to former President Harry Truman in recognition of his efforts to establish the Medicare program. In 1965, less than half of Americans over 65 had any form of health insurance. Today, 90% of seniors, that's over 46 million Americans, are covered by Medicare. Taken together, Social Security and Medicare account for 41% of federal government spending. To try to understand more about Social Security and Medicare, I've invited two experts on the topic into the studio. Older Americans rely on the benefits of Social Security and Medicare, but both programs are very complex. Tonight on The Best Times, we'll get answers to the public's most common questions about Medicare and Social Security. Funding for The Best Times is provided by the Plow Foundation, striving to do the greatest good by helping the greatest number of people.